All right, we are going to talk about how to critique bitewing images. Now, I have a couple different sets of bitewings here, and I clipped out just the part where you write your critiquing results. So this comes off of the document where there's other information on it, but I couldn't fit both on the slide, so I'm just using this. And since these are just bite wings, we're only going to be using the 4 bite wing boxes. So this is your molar, this corresponds with this one. This is the premolar, that corresponds with this one. We're going to jump over to the other side. This is the premolar, corresponds here, and the molar corresponds. All the rest of them are part of the FMX, and we're not critiquing that right now. So we're just going to do this exercise for the bite wings. So as a review, what we talked about in class was P is for positioning. So it's your positioning, your ideal positioning. Did you place the sensor in the right place? When the picture was exposed, does it need to move in a certain direction? So the way we do that as a reminder is if the positioning error has occurred, we're going to come in here and mark an X. Let me get my annotation. We're going to mark an X in the box. And then we're going to, sorry, it's going to be harder than I want it to be. We're going to mark an X in the box, and then we're going to color in the triangle where the error has occurred. So if we need to move the sensor up, then we're gonna highlight this. If we need to move the sensor anteriorly more toward the front of the teeth, we're gonna highlight here. If it needs to move posterior, we're gonna highlight back here. If it needs to come down farther in the floor of the mouth, we'll go down here. So I'm gonna clear all that. And so that's the positioning. If there's horizontal angulation, we just simply make an X. We don't have to do anything other than make an X. If there's beam centering error, we just simply make an X. We don't have to do anything other than just mark it. And if there's vertical angulation, you just also make an X. So the only one, oh no, excuse me. We do, with beam centering, we do mark where we're going to move the PID to fix the beam centering. And so like we talked about in class, if the beam centering was right along here, let's say this was a beam centering error and all of this was white. I bet I could even make it white. So let's say all of this is white. So this is a beam centering error. We have all of this white. Then what we're going to mark here is we're going to mark that there's the error. So we'll put a X in the box with the B, and then we're going to say which way would we move the PID in order to correct that beam centering error. And because we know that this part, because it's white, it didn't get any exposure, it didn't get any radiation, we have to move the whole PID down. We have to move it down toward the direction of where the beam centering error is. So then we would just color in that part. So that's how we mark beam centering error. And then, like I said before, horizontal is just an X, vertical is just an X. And then for the positioning, we're gonna mark in the direction that we need to move our sensor in order to correct for the error. So let me get rid of all of these again. And now we're gonna actually go ahead and critique this film. All right, so we're going to take this first X-ray here, and this is going to be what we're going to use to mark down the errors. So the first thing we want to do is we want to find our second molar. We know that this tooth here and this tooth here are our second molars, and I'm going to draw a straight line down here because I'm going to ask myself, are those second molars centered on the film? Now, if those second molars were centered, we would expect to see them more like here, almost more like where the first molar is. But these second molars are actually back here. And so because they're back there, I know that the person who took the film did not center the second molar. So right away, I'm going to make an X in the positioning. And I'm going to say, well, do they need to move the sensor farther back in the mouth, or do they need to move the sensor, pull the sensor more forward? Well, I know we want to see these teeth centered on the film. So in order to get this line to be more like where the red line is, this whole film would have to go this direction. The whole film would have to be pushed posterior or pushed that direction, and that would then make this purple line in the center. So the operator needed to put the sensor more posterior, and so I'm going to fill in that line there saying the sensor should go more posterior and it should go farther back. Other than that, they're really centered well. We have 50% of the maxillary teeth, 50% of the mandibular teeth. You see bone. So all of that looks good. Um, when we're looking for horizontal angulation, we're looking between the molars, and we can see some horizontal angulation here. And so we're going to mark, yes, there is horizontal angulation. You don't have to say anything else. We can see a little bit here. We can see a tiny, tiny bit here, but this is our biggest amount of horizontal angulation. So we're going to mark yes. There is no beam centering and there is no vertical angulation. So everything else there is fine. Maybe I should just leave the drawings. Okay, so we're going to go here to the next one. And the first thing we're going to do is think about positioning. So we have our premolars, first and second premolars. We have the canine, and we have more than half the canine. And we do have the distal of the canine here, though because of the way this patient's teeth come together, it's overlapped and we don't see very much. So this is going to be a problem, but really their position technically is fine. We just came upon a problem just because of the way the patient's mouth is, but they pulled it probably as far forward as they could, but what they needed to do now is move it more at an angle across the arch, heading toward the other opposite canine to get a little bit more image down here. So we're going to say position is fine. We're going to leave that blank, but we are going to mark horizontal angulation because it's clear we have it here. And then we have it back here, but we don't really need to count that because this is a premolar shot. There is no vertical angulation and there's no beam centering. So that's the only thing that we would mark for that one. Over here, we find the exact same thing. We got 50% of the canine, more than 50% up here. So positioning is great, but we do have the horizontal angulation and no beam centering and no vertical angulation. So that's our only error. And then when we go to this last one, we can start again at positioning and we can do the same thing. We have our second molar is there. But is that centered? Because this is more like our center of our film. I don't know if that's perfectly centered, but we say, no, this is not centered. This is too far back, or it's not back far enough. So in order to get the second molars centered on the film, the whole sensor would have to be pushed back this way. So then we're going to make our X. Here, I'll be consistent with my colors. We're going to make our X on the positioning. And we're going to say the whole sensor needs to be put back farther in the mouth, more posterior. Notice how these are opposite sides. Notice how this is posterior and this is posterior because posterior is this direction on both sides of that critiquing form. And anterior is coming in toward the midline. So you want to mark this here. There's no beam centering. There's no vertical angulation. We do have horizontal angulation errors. So this is how we critique for errors. That's only errors right here. So far, all we've done are the errors. But now we want to critique for retakes. Okay, so we've done errors, but now we want to do retakes. So I'm going to clear all my, oh, I don't want to clear it all because I want to keep these in here because this is what it would look like. You'd keep these marks here, but I'm going to do a different color. I'll do, well, it's on blue. I'll do blue. Okay, um, so now we're going to and get my pen here. Okay, so now we're going to go back and now we're going to critique for retakes. So a retake only has to happen when you are missing diagnostic information. If you have the diagnostic information, even though there's errors, you do not need to retake the film. So we're going to count up our contacts. And the way we do that is we start at one end and we're going to find the teeth that match in the films. So this is our second molar and this is our first molar and this is closed. And let's say, the rule is if it's closed more than a third, it needs to be retaken. This is hard to tell because we always blow it up so we can really tell. This to me looks about a third, maybe slightly more, but I can hop over here and this is the exact same contact space as this, and this is open. So this is good. So I'm going to say good because I can see it here. This next one is good. This one is good. It's really open here, and this is good. So my upper right is totally good. So there's no retakes for this upper right. I'm just going to keep moving right across this way because I'm counting up my open contacts. That's open. This is almost open. It might be like a hair closed, but it's pretty much open. This is a hair closed, but it's open here. And this is open and it's closed here. But so on all of the maxillary teeth, in the four sets of bite wings, I have at least one open contact everywhere. So I'm good with the maxilla. So now let's consider the mandible. So this is an open contact. That's good. This looks good here. This contact is closed, but it's open here. This is closed and it's closed quite a bit and there's nowhere else where we see this contact. So now I have to come in here and put an R because we are going to have to retake this beautiful bite wing. It's a great bite wing, but we are going to have to retake it in order to open this contact. So when we do that, we're going to focus right in on this area, not worry about anything else, just try to open that contact when we retake that film. And when we can come over here, we know we've got the exact same situation. This is closed, it's closed more than a third, and so we're going to have to retake it just for this area. Everything else, though, we have an open contact at least once. Open, open, that's closed, but it's opened over here. So those are our only two retakes. So these are our marked errors, and these are our two retakes. And that is how you critique a set of bite wings for errors and retakes, and you have to do that every time. So we're going to clear all of this out, clear my drawing, and we're going to go to the next film. And I'm going to move a little bit faster since I did a lot of explanation. And if you need the explanation, then you can restart the recording, but I'm just going to go through it like I am, where's my annotation? Oh, here it is, up here. I'm just going to go through it like I am just critiquing my films. So find my second molar. Here's my second molar. Is it centered in the film? No, it's not. Which way do I have to move my sensor? I have to push my sensor back more posterior in the mouth. So I'm going to make an X and I'm going to fill in the triangle that indicates moving it posterior. It's even, roughly, it's even from top to bottom. So there are no other positioning errors. There is horizontal angulation. So I'm going to make an X here for that. There is no beam centering and there is no vertical. So I'm going to move on. This one has a crazy amount of horizontal angulation. So I'm going to put that. These are all closed, closed, closed. I can notice here, this line here, that is beam centering. So I'm going to make an X, and then I would need to move my PID down to cover that white area. To correct for that beam area, I would have beam centering error. I need to move my PID down. Now this is incredibly dark. It's hard to see, but you can, the contacts are open and there are the distal of both contact or both canines. It's a pretty poor quality x-ray overall, but we could probably, if we were in Axiom, we could probably lighten it up a little bit, but you can see the distal of the canine. So positioning on that one is okay, other than the fact that their bite is open. So you can't see the maxillary as well. So I can't write this super well, but for this one, I would say patient didn't bite down. And I would put that, I would write that. This is going to be, see, I'm trying to see if I can get it small. No, it's just going to be, I would write that and then I would put it in the box. So I would write that right here in the box. Patient didn't bite down, or I would say open bite. So I would make a note of that so that my instructor knows that I know. So I would write open bite right here, because see how this is a big black gap and you kind of lose some of the teeth. So the patient did not bite down enough. Okay, moving over here, we have the distal of the canine here, distal of the canine here, ever so slight horizontal angulation. So I'm going to write an, an X here. Sorry, it's hard to do it with the mouse. The positioning is okay. Again, slight open bite. I might write that here, open bite. But other than that, this one is okay. No beam centering, no vertical angulation. On this last one, we have the second molars there. They are not centered. I'll ask myself, would the sensor needed to go more anterior or more posterior in order to center those second molars? And the answer is the sensor needs to go more posterior. So I'm going to put an X there and I'm going to fill in the triangle, indicating that I would move the sensor back in the mouth. I'm also going to notice the horizontal angulation and put an X in the H box. And there is no beam centering and there's no vertical. So now I'm going to consider retakes. Do I need to take any retakes? I'm going to count up my closed contacts. Now, when I start here, this is closed and this is very closed. So if I determine that this is more than a third, I will retake this film. It's a little bit hard to tell because it's dark and I can't blow it up. Like I said before, if you're in Axiom, you can make these full screen and then you can really tell if it's less than a third or more than a third. But I'm going to go with it's more than a third. So I'm going to put an R for retake. If I look at this one, this is closed, but it's open here. This is closed, but it's open over here, and the positioning is okay. It's not perfect, but it's probably enough information to not have to retake this. Although this area, as dark as it is and not showing the bone, this is a kid. I just know the patient, so I know that this is a pictures from a young kid. So taking that into consideration, we probably wouldn't retake this film. Um, but if it was an adult, likely we would. If we go over here, contacts are all open. I'm going to add up my contacts. This one is closed, but it's open over here. We get the distal of the canine, and even though it's very dark, you can still see the bone. So this is okay. And then this contact is very closed, but it's open here. These are the same teeth. This contact is closed here, but it's open here. So we have every contact open at least once. So for this set, even though this set doesn't look nearly as pretty as the one previous, it really probably only has one retake. So I'm going to clear this and we're going to go to the next set. And we're going to start with positioning. So here again, we have our second molars. Ask ourselves, are these molars, second molars centered on the film? The answer is no. Does the sensor need to go anterior or posterior? It needs to be pushed back. So I'm going to fill that in there. Now I'm going to look for horizontal angulation, and I'm going to mark it because I see it. There is no beam centering and there is no vertical angulation. This one we have this one's good because we have something new. This is a pretty open bite and we can see better. It's a better quality image and we can see better that the bone is cut off. So this is a positioning error of a different kind. So we're going to make an X. We do have the distal of the canine here and the distal of the canine here, but we don't have the bone. So the sensor, really the patient probably needed to bite better, but what we're going to say is the sensor needs to go down more so that we can see the bone. And then we're going to mark for horizontal angulation because we can see that we had that as well. So the film was placed from front to back, anterior to posterior, fine, but it does need to reveal this area of the bone. So probably what would have fixed it was if the patient closed down all the way, but perhaps the sensor was not set up correctly. That could have been a problem as well. No vertical angulation error, no beam centering. So we're going to go over here. Again, we have the distal of the canine here and the distal of the canine here. So positioning is fine that way, but we don't have the bone down here. So we're going to say positioning error. The sensor needed to be moved down to reveal the bone down in the mandibular area. And there is quite a bit of horizontal angulation. So this is a problem there. And these should come off, but that's probably going to be a problem here. Okay, and then this last one, this is our second molar. And this actually is kind of a tricky one because this is actually very centered. And I would probably go with this. So positionally, they got it really quite far back in this patient's mouth, enough to see a little bit of the third molar. This is their third molar or their wisdom tooth. So position is pretty good. It could have gone up a little bit, so I am going to mark it and say that it could have gone up a little bit. There's quite a bit of horizontal angulation there, so I'm going to mark that. And then there's beam centering right here. So the PID needed to come down over here to cover this area here. And there's no vertical angulation. So that's how we would do the errors. Now let's do retakes. So this is going to be a problem. If this is a third or more, then we're automatically going to have to do this again, just like we did that first time. We're going to have to retake that. And this is actually good because it'll show us this bone. We can take it again in a way that'll show us the bone. So both these are retakes really for a number of reasons, for the bone and for the distal of the mandibular canine. This here is closed here and it's closed here. So we would hope that we could open this when we retake this film, but if not, we are going to have to retake this one as well. So if we get lucky and we would take this first, we would retake this one first. And if we opened this on our attempt to retake it, then we wouldn't do it. But if not, we would have to take this one next. This is good we got lucky here because this is closed really bad, but it's open here. So this is open here. So this side, this film is fine. We would just need to retake for this area here. So 2, possibly 3 retakes for this one. And we have one last set of films that we're gonna evaluate. And let me get this annotation. So we'll start here. And just like before, I don't think I can get rid of that. No, sorry, I have to have it back. Um, okay, so just like before, we're going to look at our second molar. It's not centered, so we need to push the sensor back more posterior. So we're going to mark that on our thing here. We're going to look for horizontal. We did find some, so we're going to mark horizontal angulation. There's no beam centering, no vertical. And then for this one, when we look at positioning, what's missing down here? This is our second premolar and our first premolar, but we're missing the distal of the canine. So now we're going to ask ourselves, which way do we have to move the sensor so that we can guarantee that we can see the distal of the canine? And the answer is we have to move it anterior. So I'm going to color this in. And then truthfully, the patient could close a little bit. It doesn't look like they closed all the way. And then we're also going to look for horizontal angulation. We found some, so we're going to mark that here. There's no beam centering and no vertical. Now we'll jump over here. Same problem. We don't have the distal of the canine, and even this is not very much. It's probably enough, but it's not ideal. So we're going to look at our positioning. And we're going to say to ourselves, do we have to move the sensor more anterior, more posterior? And the answer is anterior. We need to move the sensor toward the front teeth to get more of that distal of the canine. Now we're going to look for closed contacts. This one's beautiful. There is some horizontal here, but we don't have to mark it because it's not in our key areas. And so we can leave that. And there's no vertical angulation, no beam centering. Now we're going to go back to positioning error, sorry, for this one. This is not centered, so we're going to say, do we need to move it anterior, posterior? The answer is posterior. Up and down is pretty even, so we're okay there. Horizontal angulation, definitely have it in several areas, so we're going to mark an X here. No beam centering, no vertical. So now let's think about retakes. How many retakes do I need? Well, when we look at it, we know automatically we need to retake these because we didn't get the distal of the canine. So these are automatic retakes. Even though the contacts were good, those are automatic retakes. And then this contact is closed here, but it's open here, open. This is closed here, but it's open here. This is closed here, but it's open here. Closed here, but open here. So all we need is the distal of the canine. So again, when we go to this set, we're just only going to focus on the distal of the canine. So we're going to not worry about contacts anywhere else. We're just going to worry about capturing that mandibular distal of the canine. And that's all we're going to have to worry about for those retakes. So hopefully by watching that, you have seen the thought process enough and you feel like you could critique bite wings as well. We're going to critique bite wings in lab a lot, pretty much every single time. And so this should become second nature for you to first pick out your errors and then pick out the retakes, the films that you have to retake. And remember, just because you have errors in a film does not mean that you need a retake. So that's that.